I've been working and trying to bolster the Section 317 immunization program for many years. And as we recognize this year, because of the pandemic, there's been significant increases in vaccination funding going out and building an infrastructure. But I don't want to take our eyes off the long-term need for Section 317 programs to sustain improvements that have been made in terms of routine immunizations, which must be given. And so will the CDC request an increase in funding for the 317 program this year, Madam Director?
I'm going to let Dr. Anchuk take that question.
I want to thank you for your longtime support for the immunization needs of the nation and the incredible progress we've been able to make, particularly among children. COVID, the pandemic, has really highlighted that we are not where we needed to be with adults, and that was part of the slow start that we had in terms of getting, having the scale up of vaccination. So there is a lot more work to do to catch up for the vaccines that weren't given during the pandemic in children and to strengthen our infrastructure for adults going forward. And so that work is part of the priorities for the agency.
Thank you very much. Dr. Walensky, this is not the first time I think this topic's been breached, but suicide epidemic has been startling across the country, related to pandemic and perhaps related to other factors. And CDC has produced some startling statistics recently about suicide. And I know that CDC has launched some new suicide prevention efforts over the last couple of years, and let me encourage you to continue to do that. But I understand only a handful of grants applications were able to be funded, and one of those that were not funded was from my state, but we were not alone. And what are you intending to do with respect to the overall suicide epidemic and also the more robust funding for prevention?
Thank you, Senator. This is such a challenging area. We had scale up of mental health challenges before the pandemic, right? So these were issues that we really needed to tackle before the pandemic. And we saw during the pandemic that these have only gotten worse. Among our youth, among our middle-aged, we've seen challenges even since the pandemic began. So part of our resources that we're requesting is to scale up these efforts. Again, we need surveillance data. We need to understand how much this is a challenge, how many people are presenting to the emergency room. We need toolkits to deliver to states, to physicians' organizations, so that they are empowered as to how to prevent it. And then we need actionable implementation that we can do for prevention in areas of mental health.
Thank you. One final topic is lead exposure, which I have been working on through my responsibilities on the Banking Committee and also the Appropriations Subcommittee on Housing and Urban Development. Over the last year, rates of screening for lead poisoning have decreased, obviously, as movement and these types of activities have been curtailed. And then I think the statistics will be probably very dubious coming out of the last year because of all these other factors. But it is a continuing problem. And right now, CDC's lead poisoning prevention program is at a high mark of $39 million. But we know more funding is needed. And we also know that this is an issue that disproportionately impacts low-income communities because of the housing circumstances generally. And I would hope that the President's CDC budget will prioritize his work, keep increasing funding, and focus. I would note he's going after the lead pipes, which I applaud. But in many respects, particularly in older communities like mine, the issue is the lead pipes, it's housing and lead paint, and it's a whole series of issues.
Thank you. I think this raises a very similar point as was previously raised by Senator Hyde-Smith, that each community needs individual things to improve the health of their community, which is why the public health infrastructure flexibility, the funding to be able to get the resources that you need in individual communities. One will be, we need resources for broadband, but one will be we need resources for lead. So, and as you note, we again had an MMWR that demonstrated exactly what you said. Screening for lead this past year has gone down. We know we've missed lead toxicity that we really need to make up for.
Thank you very much. Thank you, Madam Chairman.
Thank you. Senator